Now, once we have diagnosed the patient, our patient is having hip osteoarthritis, then what we need to know is that what is the age of the patient and what is the status of the AVN. If the patient age is quite young and we have the AVN has not progressed to a post-collapse state, then probably there are certain non-surgical options we can use to retard the process eventually leading to the AVN of the head of the femur or increased development of osteoarthritis of hip joint. Now, for example, this may include pharmacological treatment such as in form of NSAIDs and paracetamol. Other form of NSAIDs can also be given. Although prolonged use of NSAID for 3 or 4 years, 5 years is usually it has its own side effects, especially in the patient who may be diabetic as well, and they may have hypertension as well, and they can have kidney problems later on, along with the excessive use of NSAIDs as well. But this is one form of doing it, that we can go for use of NSAIDs so that the patient becomes pain-free. The other is making them non-weight bearing, use of walking aids. For example, if the patient is having a problem on the right side, you can actually bear weight over the opposite side and using a cane in the opposite hand and using the crutches on the same side. Now this would actually reduce the weight which is actually going through the exposed joint. This would help the patient become pain-free. A patient will be able to do the activities of daily living with less amount of pain, and adjunct use of NSAIDs and walking aids can help the patient continue with the native femoral head for a prolonged period of time. Other is the weight reduction, because usually our own weight is actually a problem as well. If we are obese, more of the axial load is actually transmitted and more weight is joint reaction forces are generated, and this actually leads to increased degeneration. So weight reduction, and first and foremost, especially in the case of knee osteoarthritis, and it also helps in the hip osteoarthritis as well. Therefore, these are some of the non-surgical management before the head has actually collapsed or the disease has progressed severe enough, which will eventually lead to some form of a surgical treatment.